Over from, ladies and gentlemen, welcome to the show. Dr. Jane Jenab is back for more. So you and I were just on Instagram Live talking about the system, the limitations and the frustrations of the healthcare system, especially how it, A, really limits doctors from doing the best thing for the patient and being in that space, and then also the way it treats us. This is this realm of moral injury, which I think is really interesting. And with COVID, this is kind of how we framed it before. COVID is really pulling the curtain back on a broken healthcare system in so many ways. And this is a big one. This is a big one. Let's in case people didn't see the previous interview, let's set the stage a little bit. Tell me a little bit again. Basically, go on the rant that you just did a minute ago because
I just did it.
I know, but it was good.
Was it?
Well, I think you put, as you were talking about it, I was sitting here and thinking, and I went to medical school for the right reasons. I wanted to help people, and not just like save lives in a moment, but actually with the person in front of me, what do they really need? Like, what do they really need to restore their health, get their life back on track, whatever. And part of my mission was wanting to work with the poor. And so that leads sometimes to rural California or inner city Compton. And especially if you work with the poor, you have more and more limitations. You're less able to do that stuff. And this is where we can kind of get into the weeds of it a little bit. Some of it is just there is no money, that service doesn't exist. But some of it borders on this is wrong. Like, this is wrong that the system in this country isn't able to help this person more than it does. Give you a couple of examples, but I'm going to turn it to you. So when you were talking about it, I was sitting here, and I think it's normal to kind of feel a little bit of guilt. It's like, God, I've done this for a decade. I've sent some people home that I really wish I could have done something else with. They needed more than I could give them in that reality at the time. And part of me has just like accepted that I'm not a gastroenterologist. I can't scope this person. They're not going to let me transfer him. It's follow up with your PCP and get an outpatient scope, which never happens, And here I am, like, trying to do everything I can. Well, stop drinking. We're going to put you on a PPI, da-da-da-da-da. You do all those things. And, it's like, but they really need the camera to look in their stomach and diagnose of what's going on. Like, do they actually have an ulcer? And da-da-da-da-da,
There's not only that aspect of it there, because obviously the net has lots of holes in it. Ideally, everybody would have a primary care physician. Ideally, everybody would be able to call that PCP the next day and get in within the next few days. But there's also the side of it that, I have patients who've refused admission when they knew it meant going home and dying because they could not afford to pay for the hospitalization. I have prescribed medications that could be life-saving for people that I know they never filled because they couldn't take the money from rent or from putting food on the table for their kids. It is heartbreaking because our system as a whole has failed, and we see it in very real ways. Mm-hmm. The emergency department is a great equalizer. Mm-hmm. I have seen CEOs of the biggest companies in the United States, and I have seen the alcoholic who fell down and is unconscious in the street, and everything in between. But again, when I think, let me back up. I think one of the reasons that I went into emergency medicine instead of going into something like clinic practice for family practice or something like that is that I didn't want to have to fight with insurance companies over whether or not a patient needs to get a CT scan. I'm a
Exactly.
fucking doctor. I know whether or not they need to get a CT scan. And in the emergency department, I don't have to worry about that. Whatever the patient needs within my capability of getting done for them that day, I have the ability to order for them, and it gets done. It is, I listen to my friends who are in primary care who are fighting with insurance companies over MRIs for people who likely had a stroke 2 weeks earlier. And I had a patient recently who saw his primary care physician, and he had a walnut-sized mass on the side of his neck. He came in to see me a month later, and it was enormous.
Mm-hmm.
And it was, of course, squamous cell carcinoma that had spread throughout his entire chest.
Cancer.
His doctor had ordered a CT scan. It took him a month to schedule it. And in that time, that patient went from potentially being able to be treated and saved to likely a terminal diagnosis. That is moral injury. That we know what the right thing to do was. We know what the patient needed, but we're now having to fight because of money, because people are greedy, because hospitals want to make their cash to allow patients to suffer and potentially die.
Let me kind of push back a little bit on something. It's
I'm getting angry, Larry.
Well, I can see it. I think for anybody, I wouldn't deny the cons of the profit-driven hospital system and groups. I don't deny that. That said, resources are not unlimited. I think there is a bit of a fixed pot on this, whether you're talking about Medicare, whether you're talking about whatever. And so part of the question is, how do you spend the money?
Larry, you take the $20 million bonus that the freaking CEO of the insurance company got. Tell me how many CT scans you can get with that.
Yeah, but I don't think that, I don't know what the numbers are, but I think they're at the end, you're still going to have the same, you're still going to have limits.
Obviously, at some point there are going to be limits, but there is so much fat that has been trimmed and handed to people who have nothing to do with actual patient care that could have been used for life-saving treatments and measures for patients. And I don't think there's any denying that.
I don't think so, but the challenge to you, the future governor of wherever you're going to be, is there are not unlimited resources. How do we use them? And what's the process? What are the checks and balances? I don't think there'll ever be a system, unless you're really rich, where you write a blank check, you hand it to the doctor, and you can do whatever you want. Now, I'm not. These examples that you give are good examples of when people should have had care. Not what I'm talking about. There's also waste in the system, and I think the practical challenge to moving forward is, because it won't be an unlimited resource system.
So here's what I'd say to that.
How do we make?
First of all,
you see the question.
You put people in charge who don't have their own interests ahead of the patient. And I think that is the biggest problem in healthcare right now. We have for-profit insurance companies that should not exist. There should not be someone between the patient and the physician who is taking money from both sides. Physician compensation has gone down drastically over the past 20 years, and costs to patients for their insurance and actual coverage for their medical expenses. The cost has gone up, the coverage has gone down. All of that money that's being taken from both sides is going to these for-profit companies. They should be eliminated.
I feel like this whole third party payer, whether it's insurance or the government, I feel like it can be solved by an app. You know what I
It
mean?
might be.
That like
It might
takes
be.
a fraction of what they do, uh, and just cuts out that middleman, just like these,
Yeah.
have done in so many ways. I
Let's
have
do it,
loved,
Mary. Let's do it. We
I've
can
loved
finally
it.
pay off our student loans.
I've loved the idea of direct primary care. I mean, that one
Yeah.
cuts all of that out, and it
Yeah.
makes so much sense. And everybody's happier. The doctor's happier. The patient's happier. They're paying, all of that stuff.
Yeah.
One of my problems with Medicare for all, although it solves some problems, is it's a what, 70 or 80-year-old model. It's like a 1950s car saying everybody needs a 1950s car.
I think Medicare for all, and I will admit I'm not the most versed on this, but I think Medicare for all is being looked at as a bridge, in that right now we need some way to cover people that it is not going to bankrupt the individual. And as we know, medical expenses is the number one reason for bankruptcy in the United States. We're one of the only countries in the world who hasn't figured this out. Some way to provide basic health care for everybody, which is shameful, in my opinion. But I think that people are not looking at Medicare for all as the end all be all. I think that it is a bridge until we can get something that is more updated, more beneficial and cheaper.
I'd say cut the chase and get that thing now. I don't,
Yeah.
Maybe I think San Francisco tech companies can solve everything with an app on your phone. Let's kind of step back, and it's the beginning, mid-January. COVID has not gone away. In fact, in so many places it's worse. How is it where you're working, and what is the experience? It's been a little bit since you and I have talked on one of these. Like, how are you right now? How were you 3 months ago and 6 months ago and whatever? Like,
COVID where I'm working is bad. Not as bad as some states, because I'm currently working in Albuquerque, and the governor of New Mexico has been quite strict. The problem is that not everybody is following the rules. You know, Arizona and Texas are still hotbeds of COVID, and all people have to do is drive across the border and they're in New Mexico.
do you see that? Do you see people from both
yeah.
states that come in and affect and kind of transmit that to your?
Yeah. And the other problem is asymptomatic spread. So I had a patient the other day who came in symptomatic and said that, or I'm sorry, came in for something other than COVID, said that she knew that she was positive for COVID because her grandmother was having an elective procedure, and everybody around her and who was going to be near her after that procedure needed to get tested. None of them were symptomatic, and the entire family was positive.
Mm-hmm. Wow.
So if you don't feel sick, you're not going to feel as strongly about being strict, even within your own family, with, face coverings and distancing and things like that. So
are you COVID on your shifts?
Am I what?
Seeing a bunch of sick COVID patients?
Oh yeah, every single shift. Every single shift. And for a while we had patients just backed up because we had no beds.
Yeah.
Where I work, 80% of the beds were filled with people who were waiting to be admitted to the hospital. So then the folks who are sitting in the waiting room are getting angry, but we don't have any beds to bring them back to.
Yeah.
To actually examine them. I admitted people from the waiting room. I did complete workups on people who were sitting in the waiting room. I discharged people from the waiting room because I simply had no other place to see them. And that's happening. That's happening everywhere. Um, Again, New Mexico is not as bad as Southern California right now, and not as bad as Arizona right now.
I would say, I want to say what it's like in some of the places I'm working at. The Northern California ones, I see a lot of kind of urgent care level COVID, people that aren't that sick. We'll do a send out test sometimes. Sometimes we don't test them because,
Mm-hmm.
you know, the ER is not the place. And then occasionally I'll have somebody that comes in either sick, ICU sick, big
Mm-hmm.
trouble sick. Oh man, this is sick. More frequently, maybe once every few shifts, well, maybe once every few shifts, somebody like that. And then more frequently, somebody who's fine, whose oxygen level is 89, and they need to be admitted for remdesivir and dexamethasone and so forth. When I was in Compton a couple weeks ago, one day I admitted 10 people. They were all COVID, every
Mm-hmm.
single one of them. Some of them were 37, 43, not a lot of medical history. They were sat, and it was the same story every time. It was like a week of symptoms, then they got short of breath, and their sat was 88% on room air, and they were breathing a little heavy. Maybe they had a little bit of diabetes, whatever, and and in my experience, they were all Mexican. They were all Latin American, so not even black in this in Compton. And so they got admitted, and that hospital has just blown up to
That's
over
that's
capacity.
about every shift where I am. That's about every shift that we are admitting. Where I work, this is the only place I've ever worked where I had, 4 or 5 physicians or NPs, PAs on at the same time. Usually where I work, it's single coverage. It's just me. But I'm working a place now where there are 4 or 5 of us on at a time.
Busy.
Most of the time, yeah. And but there are times when I'm still, everybody checks out to me and I'm the only one there. I had 11 admissions checked out to me the other day. That
11 years.
11 boarders who were sitting there waiting to go to a hospital bed. And the place only has 14 beds. Yeah. So that leaves 3 beds.
Oh, that's 11 boarders in a 14-bed ER. Oh, wow.
So
that's crazy.
And they were all COVID. So, and then one crashed, and I'm the only one there. And it becomes a safety issue as well. And that is another thing that I'm pushing back on, is that they're not only expecting us to work harder and see more critically ill patients in a shift, but they are still pushing us to see the volumes, and that is unsafe. And people are worried about making mistakes. And I know people have made mistakes and they have had bad outcomes. Mm-hmm. And that is, again, because they're more worried about the dollar than they are about the patient or about the physician. The trauma that a physician goes through when they have a bad outcome that could have been prevented, but they missed it because they were being pushed so hard to see so many patients so fast, that stays with you for a lifetime. I know people who are talking about leaving medicine because they had a bad outcome, because of the pressure that was being put on them by administration to see patients faster. And that again goes back to moral injury. It goes against our moral code to not take the time to sit down and actually care fully for one patient before moving on to the next. If you're juggling 15 balls in the air, at some point, one of them is going to drop. And sometimes that drop is not too bad. Okay, the patient wasn't really harmed. Okay, not going to be any long-term effects. Sometimes it means somebody dies. And how do you go home with that? My colleague, somebody I know had a bad outcome recently, spent 3 days crying about it, and then spent the next 4 days before going back to work trying to decide if they could force themselves to open that door and walk into work for their next shift. And they are contemplating leaving medicine altogether. And they are blaming themselves with the knowledge that they were pushed beyond what we consider safe when it comes to patient volumes and and the speed with which we see patients. I'm not willing to compromise patient care. I don't care if I never get a bonus again the rest of my life. I honestly don't give a shit. I'm going to take care of those patients to the best of my ability. I'm not going to let administration push me into doing something unsafe, which makes me popular with my nursing staff and with my colleagues and with my patients, but not so popular with administration, which is why I'm considering throwing in the towel when it comes to this type of care, this type of job.
Mm-hmm. I don't have anything to say.
I mean, unfortunately, I feel that the face of medicine has changed. COVID has changed how we will practice medicine going forward. I don't know if we'll ever be able to see patients without a mask on again. I don't want that. I don't want my patients to not be able to see my face, not be able to see my smile. I don't want to not be able to see them. I don't want to feel like I'm risking my life every time I walk into a room. I don't want them to feel like they're risking their lives every time they walk into an ER. We have the vaccine now, but not enough people are getting it. Healthcare workers are refusing to get it, which is astonishing to me.
Was it somebody told me that 60 out of the 68 cardiologists in this office refused it?
Unbelievable.
60.
Unbelievable.
Tell me that again. It was in Texas or Florida or one of those, and I was like, what? I was like, forget like the political or forget the like rah-rah vaccine part of it. It's like, you guys, that's really dumb, like for your own health.
I know.
Like,
and I don't know.
Die because
I don't know how many people are keeping up with this, but on my page, I tend to share the memorials of all of the physicians who are dying, and we're losing several a week now. And that is not only tragic for their families and their friends and their communities, but for all of the patients that they could have still saved going forward, for all of that knowledge to be gone, for all of the medical students and residents that they could have taught, for all of the impact that they could have had, not only within the healthcare system, but within their community as a whole. Thousands of healthcare workers have died. And among those are so many physicians. It is heartbreaking, but it's also infuriating because all of this was fucking preventable.
So let's
I'm getting mad again, Larry.
Anger is a natural emotion. I would encourage you to feel it and let it do its thing. The system, it is what it is. It's limited, and very often it sucks. What do you do to take care of yourself, to recharge, to cope with it? The system needs upgrades, to say the least, that probably aren't going to happen today or tomorrow. In the meantime, how do you take care of yourself?
I'll be honest, I have not done a good job with that lately. Early on in this pandemic, when we thought, okay, maybe we have a few months of this and we'll get it under control, like other countries are getting it under control, I had a little bit more of a reserve of optimism and energy and strength. I've wiped that out. I have seen lows that I have only experienced with the death of family members and profound loss that I've had in my life. I've experienced that in the last few weeks, to the point where I, one, am considering giving up a profession that I love.
Yeah.
Two, considering moving out of a city that I have loved for a long time. And three, just really questioned my whole life. So I have not done a great job of that. What I would do normally is work out and garden and bake and cook and teach and read and knit and travel and do all the things that kind of
So,
refresh myself and
yeah.
fill that well. And the well is dry and the bottom is split and cracked. And I'm usually the person that friends come to feel better, to unload, and to allow me to share a little light and a little hope. And I don't feel like I have any to give right now. And that's for somebody like me, and you've known me a long time. I don't remember ever feeling like this and feeling like this for so long.
You're on empty.
Yep. Yeah.
You're on in the middle of the pandemic. You know, when you and I have been talking a lot more recently, and I've been observing like myself and the things that I've done, and you can't take there's what we do like in the ER, and it's got its own incredibly unique historic challenges in COVID in this current setting, which make it alone really, really hard. So you've got that, but you've also got a pandemic where I know you're a very social person. Like can't have dinners. You can't cook for people like you normally do. We can't like, and so, and it's still going. it's it's coming up on a year. You know what I mean? Like,
You know, we've talked before about this, but the secondary trauma that we experience in the emergency department, watching others go through horrific events, whether it is, you know, massive traumas where their bodies are broken, or whether it is a stroke in someone who's young and it's devastating, or it is a massive heart attack in a 40-year-old and they die and they leave kids who are 2 years old and 5 years old, or it's child abuse, or it is domestic abuse, all of these horrible things that we
awful.
experience.
Yeah.
You know, that is something that we carry with us, and we rely on things like travel and seeing friends and all of these other things to bring us out the other side with a little bit of life and hope. To not be able to do that, like you said, to still have the daily grind of the emergency department, then to walk out of the ER and see so many people who are not wearing masks, who are gathering in huge numbers, who are traveling when they shouldn't be traveling, who are doing nothing to take the weight off of us as we're struggling to keep up in a pandemic, in addition to everything else that we're going through, and in addition to not being able to have the pressure release that we normally have. You are going to see a massive hemorrhage of medical staff
Yeah.
over the next year. People are leaving in droves and they're not coming back because, in addition to all that, we're working within a system that is not appreciating us, that is not saying, you know what, you've sacrificed enough. Let us do something to help out. Instead of, recommending that we go do these burnout classes or whatever, go try some yoga or bullshit like that, they're not fixing the underlying problem, which is that we're overwhelmed and we're exhausted. So they're blaming us in a sense. You're not doing the things that you should do in order to avoid burnout, versus actually fixing the things that are causing the burnout. So I think a lot of us are essentially just going to give our employers the finger and walk out. I almost walked out the last time I was at work. And I've never even considered that.
When I think I think the answer is to do both, which is you got to take care of yourself more now than you ever have before.
How, Larry?
Or
How? Tell me how you take care of yourself when you're too tired to even get up and to work out or to even get up and to cook something or whatever. I Tell me how we're supposed to take care of ourselves. We can't travel. We can't do the things that we would normally do. What's your fix for that? And put the question back to you.
I think number one is sleep and the restorative stuff, those basics, you know, little eating well and a little bit of exercise, the body, focusing on your body, number one. Number two, I think for some people, like you're suggesting, time away, if that's possible. A lot of us have to work and pay mortgages, and that's not a practical answer, but if you didn't, that would be the answer.
I don't think most people have that option.
Get away, and so most people don't have that option, and they're stuck, and a lot of people are stuck in the pandemic financially. And then number three would be finding some manner to connect with people and socialize.
Thought you were going to say finding some man.
That could
where?
Jenab.
Where is he?
A man solve them problems, solve a lot of problems for you, create a whole new set of problems.
Oh goodness.
We could talk about that next time. So, you've gone on several dates since
I dropped 180 pounds of dead weight when I divorced my ex-husband.
Well, it's time for you to bear another burden. Let's get a man life. I think you take care of yourself and you make that a priority. And at the same time, this is really meaningful work, is making the system better, you know? And I think, and maybe that, and now I don't know that in the middle of complete exhaustion is the time, but so many ways, man, it's got to get better. Let me share a couple things that I do that matters to me. When I work and I try to give it all. And when I'm away, I'm away. And part of that also means I got to disconnect from media. And so, like a lot of people, everybody wants to talk about, oh, the coup and Trump and get all flared up by all this stuff. I don't know a lot about that. That's intentional. And I know some people are like, oh, I can't do that. I want to be a part of it. I'm in the middle of a pandemic where this is really hard at work. That just stresses me out. Getting into that shit on social media, it just turns into a thing that saps my energy. I'm not doing it. For what? Who am I? I'm not a politician. I already voted. I'm not going to vote again for a couple of years. No, thank you. Keep it out of my life. And there's just so much shit on social media that are little whatevers that now I'm like, I'll just sit there and it's almost like a thermometer and I'll like look at stuff and read it and I'm like, does this make my energy go, you know, like, does this make my stress go like this? Is this adding something to my life? Or is this sapping energy? Same thing with certain relationships, with things I do and behaviors. Like, wait a minute, how many video games, how many Catan games have I played tonight? Couple is good, but like this is too much. I gotta, you know what I mean? Just all of these things where almost violently I'm asserting, no, my mental and physical well-being has to be number one, or I'm gonna get burned to the ground and not make it through this thing and be miserable. That's just me. Not every, you know, a lot of people are in the political fight. They couldn't leave that. You know, I think a lot of us are victims to our phone and the media in a way that does not support our mental well-being. And I think that's an area where people could help, you know, could make some changes that would help. That's me.
I will admit I have not been good with turning it off. I'm one of those people who feel like I can make a difference if I try hard enough. And I probably would be a little bit healthier mentally if I were to shut it off a little bit.
Maybe for you, because you care about a lot of things. So I don't think you could turn it off, but maybe you limit the time, or you're aware of, shit, this one's getting me a little too fired up, a little whatever. I don't need it. No, thanks. It just depends. It's up to you. I think there's some people who, if they totally shut it off, would be like, God, I'm betraying what I believe. Like, I need to be a part of this thing. I can't sit it out totally. Like, that wouldn't resonate either. Maybe they'd feel more guilt or whatever. But the point of the whole thing is, and this echoes exactly what you feel is so important about the patient when you're with them. It's like doing what is best, doing everything that's in your power for the patient. This is because you're very good. All of us doctors are very good at, the patient comes first. We're going to do everything we can. Most of us, not everybody, but we really genuinely want to help people in front of us.
We're crap when it comes to taking care of ourselves.
We don't do it a fraction.
Not at all. Yeah.
Like, I'm fucking Mother Teresa when it comes to that, needy person in front of me. But when it comes to me,
we're not great. We're not great at that at all.
And it's like, why? Because I'm tough enough. Oh, is that what that is? That's strength? Oh, that's an interesting version of strength story you've got there. You're so tough that you're going to neglect yourself and burn yourself into the ground. Oh, that's a really interesting understanding. Oh, well, that's what it means to be independent and strong. And this is what I did in residency. All of this Kool-Aid we drank.
Mm-hmm. We are conditioned to think, and honestly, we deal with things that most people will never have to see and will never have to do.
Cope with.
That it takes a certain personality and a certain person to be able to do that, and to not be a quivering mass of jelly on the ground every time there's a trauma or an MI. There are just certain people who are cut out for that type of a life, and those who would not do well with it. But because we are in the former group, what we went through, and I'm not going to get into that. What we went through to become physicians, and particularly to work in the emergency department, the overnight shifts, the lack of sleep, the 120, 130 hour work weeks, during med school. And we were conditioned to think that we are above a lot of things that normal folks would ever have to experience or do. And there's a little bit of a Superman complex.
That's exactly what I was thinking about.
We need to get you to stop wearing that shirt.
I wear those shirts all the time, but I've owned it, and there's an asterisk. I was just thinking about that shirt, and like, out of the big S, like bursting some kind of a heart or something, like taking that emblem and logo and modifying it, because it does feed into the invincibility fantasy. Like, I wish I were energy Superman. I'm not. And when I'm on, I sleep in sometimes until like 2 p.m. Like, I sleep like crazy. And like, part of me is like, God, you're such a piece of shit. And then there's another part of me that's like, nope, you just did 4 night shifts in a row. You get to do whatever you want. You just listen to the body and take care of it. That's it. But you could be productive, you piece of shit. It's just like, I'm not listening to that guy anymore. I'm going to take some naps,
Well, we talked about this as well. We're both getting older, and we're not as willing to put up with that kind of stuff. We're also it's not as easy for us to bounce back from things like night shifts.
Oh, sometimes they're the worst.
They are always the worst. I hate night shifts.
I hate them too. That's half the job. That is
not for
me.
Me.
The places I work.
Not for me. So, don't you have to catch a plane, Larry?
I need to get on a flight. This has been, it's always really good. I want you, number one, I want you to do what's best for you and take care of yourself. I don't want you to leave medicine. You're a good doctor. Somehow let's figure it out. maybe you can like kind of keep your toes in and also change the system or something. But I
Just,
do
just a tiny little task there.
I do want you to take care of yourself. We all have to take care of ourselves.
You as well, Larry.
I'm working on it. I'm working on it by eating a healthy breakfast. I'll post this. This will be up on the YouTube channel and the podcast. You can always find Dr. Jenab on the socials. What's your handle?
Twitter is at Jane Jenab. Instagram is at Jane M, like Mary Jenab. And then I only have for Facebook. It's really just my friends, so I don't really add folks.
Twitter and Instagram. You heard it. Ask us some questions. Thanks for doing this.
My pleasure.
I'm going to call you in a minute when we're done and I'm on my way to the airport.
All right, Lorenz. Good to see you as always.
All right. Thanks, Doctor.
Love you.
Love you too. Bye.